Welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, and I'm a communication specialist with the Nashua Division of Public Health and Community Services. Today, we have a special guest, Evan Devaney, who is a third-year medical student at the University of New England up in Maine. Welcome, Evan.
Thank you. Thank you for having me.
So Evan has been with the division for 4 weeks now as part of your third-year medical school rotation. So tell us a little bit about yourself. The biggest thing I learned, well, I learned it a few weeks ago, but was that you're actually from New Hampshire. So tell us, you grew up where?
I grew up in Concord, New Hampshire.
We'll let that go. I guess that's okay.
Went to Concord High School, and then went to Stonehill College in Easton, Massachusetts.
Okay.
And then I came back to New Hampshire for 2 years. I worked in the Concord School District as a soccer coach for a couple of years.
Wow.
And then went off to medical school. So I've been up in Maine for the past 2 years. And then our school we go all over New England for our third year of medical school. So 8 students from our class of 150 get to come to Nashua and do their entire third year at Southern New Hampshire Medical Center.
Nice.
So I've been here since July. So we started right around July 4th we started.
Wow, so were you able to get any hands-on experience given that you started during the COVID pandemic? What kind of happened?
Yeah.
First with your classes, and then you probably went online.
Yes, yeah.
And then when you had started a rotation in the middle of a pandemic, what was that like?
Yeah, so it was very interesting. I was very lucky that Southern New Hampshire was able to have us come here because a lot of students had their rotations postponed.
Oh boy.
And B, I was lucky that my exams that we have to take to pass the second year, mine didn't get pushed back, but there's still some of my fellow classmates that have yet to take their exams.
Is that like your board exam?
Yes,
okay.
yeah. So I took that in June, and one of my friends is taking his on Monday next week. So he's still been studying, which can be a lot to be in the hospital and studying for the exam. So we transitioned to full online right around spring break, which was early March. We did about a month of online classes, and then the school year we were planning to be done in mid-April anyway, because they give us about a month and a half of no class to study for our board exams.
Okay.
So we weren't impacted that much. The current fourth-year students were severely impacted because they had to leave the hospitals because a lot of programs shut down, and
I see.
so they kind of had the hard. I was lucky that I was a second-year medical student and not a third year.
Timing
at the
is
time.
everything.
I know. So yeah.
All right, and so you got to Southern in July. Were you able to see patients? Were you able to shadow? I mean, what was that like?
Yeah, so I started off with pediatrics. We do 6 weeks on each specialty. So I did 6 weeks of pediatrics, and it was mostly outpatient pediatrics. We weren't seeing a lot of ill patients at that time, so it was a lot of well-child checks, a lot of catching up from what people missed in March, April, May.
Yeah, and we want to remind people that if you did miss your well-child check, now is the time. Do it now.
Right.
Don't put it off any longer.
Yeah, so that was a lot of well-child checks, a lot of routine vaccinations, stuff like that, where we wanted to keep going with those. And then I was able to do some time in the PICU, or the Pediatric Intensive Care Unit at Southern New Hampshire. So there was every morning I would start off with them, and we would go around the hospital to all the newborn and see some of the deliveries and do all the checks on the newborn babies, which was pretty exciting. It was just
so cute.
I know. It was it was a little bit different learning with a mask on and not seeing people's faces ever. But we were grateful that we were even allowed in the hospital.
Absolutely.
Yeah.
So after pediatrics, did you have a different rotation?
Yep.
Or?
So I went right to surgery. So we did.
Big change.
Yeah. So 6 weeks of surgery, which was also at Southern New Hampshire. That was pretty routine, same as it would have been a year ago. The OR scheduling was a little thrown off. There are a lot of people trying to catch up from appointment or surgeries that they missed. And I think staffing, they didn't want too many people in the OR at one time. So they weren't operating as many surgeries as as normal.
Okay.
But I was able to see over 65 surgeries in my 6 weeks.
Well, that's great. So
So,
you really
yeah.
got some great exposure. And then, best of all,
Yeah.
you came to public health.
Mm-hmm.
I'm a little biased, of course. And I think it's really interesting, and I think people should really understand, and I think it's fabulous that your medical school allows this, is that you did a month rotation with public health.
Mm-hmm.
This is your last day, so we're going to be really sorry to see you go. We had a lot of fun, if you can call COVID clinics fun, but we do appreciate that you've been here with us. What do you think the benefit is of having a rotation in a public health department? You know, because you kind of think, I'm going to medical school. I want to see the patient. So, do you feel like there's some benefits from being in public health?
Yeah, absolutely. I think it's just a unique opportunity that we get to spend time with you guys, because a lot of even our other classmates in other sites all over New England don't get this opportunity. It's unique to Nashua. So the 8 of us that are here will get to spend time with you guys. And I think there's a lot of services that I didn't even know existed that we can inform our patients about in the future that potentially are underserved or don't have the health insurance that is needed for a certain thing, that you guys can provide that service. And
Name some of them, because we always like to plug those.
So all the vaccine clinics that I've been participating in, and the community outreach that we did as well at various sites around Nashua. I think just knowing that those exist is good for, and I'm sure there's some doctors out there that are unaware that these services are going on, but just to have that in the back of your head, no matter where I end up practicing in the future, just to check in with my public health department and see what are the services that you guys are providing.
Right, because oftentimes public health gets in a position where we're providing services to the most vulnerable in our community, and those that maybe have to walk for care or don't have health insurance. And so we've been able to do that. You've been able to work at the flu clinics, and I think childhood immunizations was one of them. And then last but not least, you've been a huge help at our COVID-19 clinics, which we have incidentally every Tuesday in the Elm Street parking garage, and you can sign up for those online. They're from 3 to 5 p.m. And you have had the chance to swab, I don't know, it's like a McDonald's sign, over 300 people swabbed, 500. I mean, you just jumped right in, you got trained, and it's been a really huge help for us, because as we'll discuss, cases are a little bit on the rise in Nashua, and our clinics have been really busy. So you've had some interaction with some patients, or clients, I should say, going through the clinics. What's your impression of that?
So first, everyone has been so grateful. All the clients and patients that come through are always thanking us for doing what we're doing, which is great to hear that. And it's not always when you're in the hospital and you're getting stuck with needles and stuff, people are not usually grateful for it. Some are, but just to provide a service that is free to them, and that they know that we're risking our health to be out there. They're very grateful for that. And I wrote about this in the weekly newsletter, but it was
coming out next week.
Next week. I think it was, as a medical student, and we saw this pandemic start to play out in March, we kind of had our hands tied, because as second-year medical students, you can't really do much with patients. You haven't passed your exams to move on, and a lot of people that were EMTs in the past volunteered as EMTs to try to help out with the pandemic. But for myself, I was kind of just studying and continuing on while I saw all these nurses and doctors like asking for help. And it was very difficult for a future physician to see that and not be able to help. So this is my first real hands-on, although I've been in the hospital with surgery and with pediatrics, it's been my first kind of COVID response. And so I was very grateful for that opportunity to actually start to help out and feel like I'm making a difference in the pandemic.
Absolutely, and you really are, because when people can have that test and they can get the results, whether they're positive or negative, if they're positive, it can help us kind of stop the disease spread. And if it's negative, for a lot of people, it's a sense of relief. They can return to work. And so, again, we just really appreciate that, especially with this uptick in the last several weeks. We are just moving those cars through the clinic, and just So as much help as we really appreciate the help you've been giving us. So as you're finishing this rotation, you have the dubious distinction of giving the COVID update for this week.
Okay.
So if you want to start us off and tell
Sure.
us about the case update globally.
Yep. So globally, we have 41.8 million cases with 1.14 million deaths. In the U.S., we have 8.4 million cases with 223,000 deaths. In New Hampshire, we have just under 10,000. We have 9,994 cases with 470 deaths. This gives us an 86% recovery rate. Currently, we have 832 cases in the state of New Hampshire with 18 current hospitalizations. We have a 5% case fatality. And in the state of New Hampshire, we have a 1.3% positivity rate on our testing. In Nashua, we have a 2.1%, so just a little bit higher in the city of Nashua.
And we just want to point out, too, that that rate came down this week. It was up over 3.5%, and now we're to 2.1%. So we did have a little spike. We're hoping it stays down. We don't know week to week, but that's why we come on and give these numbers. I'll let you finish with Hillsborough County.
In Hillsborough County, we have 5,228 cases with 313 deaths.
Excellent. And then we also have Nashua numbers specifically provided to us by our case investigators.
So we have 1,160 cumulative cases in Nashua. We have 90 active with 207 contacts. This gives us an average new cases per day of 7 with 21 contacts.
And let me just interrupt too, because when we talk about the contacts, so last week we had 10 contacts, an average of 10 cases per day. And this week we're down to 7, but we're still at 3 contacts per case that we're having. So every time we have one case, we're calling 4 people, not just one, because we want to know who you've been in contact with. So as, again, we talk about this week to week, as cases are increasing, so are the contacts. And as businesses are opening up and restaurants are becoming more crowded and people are going about their daily lives, there's more exposure. And so, we'll talk a little bit about Nashua still being at a high rate of community transmission right now. So I'll let you finish. Sorry, a little interruption.
No, it's okay. So our hospitalization rate in Nashua is at 7.2%. We've had 40 cumulative deaths, and the recovery rate in Nashua is 89% with a case fatality rate of 2.1%.
Yeah, so we're faring a little bit better than the state in those areas. And then we have a graph of the Nashua weekly cases and average contacts per case, which is just something that we really just discussed, but people can see from the graph that we, the week before, October 5th through the 12th, we were really spiked. We were very, very busy at Public Health doing case investigation and contact tracing. And so you can kind of see that from this graph.
And that is the week you were alluding to, the October 5th through the 12th, is the highest case total since back in May 25th to May 31st. So.
Right, so that was very alarming for us at Public Health. We're seeing it settle back down, so that is really good news. If we could skip, Evan, to the COVID case increase that talks about community transmission. Let's go through some of these metrics that are at the community level.
So in Nashua, we have reached the substantial level of community transmission. So you need to meet one of 3 metrics to get this label.
This rating.
This rating,
yes, yeah.
And currently for Nashua, we are meeting just one of the 3 metrics, and that is new cases per 100,000 over the past 14 days. And today we are at 133.2 new cases per 100,000 people. That is down from the past 2 weeks. However, we are over the threshold of 100 new cases per 100,000, which puts us at the substantial community transmission.
Right, so we're really hoping that next week we have even a lower number and that we can kind of breathe a sigh of relief about our county and our city and the greater Nashua area. And then we also, again, we have that 7-day positivity rate, which we talked about is 2.1% in the city. And just one last slide that we could talk about is the COVID-19 by race in New Hampshire. If you want to take us through that, one of the reasons we do want to look at this is because, as many people may have seen in the news, there's a big disparity on who is getting COVID-19, and it's disproportionate in the population. And sometimes people think, well, New Hampshire, it's just so homogenous and we don't have those issues. But if you want to take us through this graph, we can definitely see that we do have these issues in New Hampshire as well.
So this graph adjusts the amount of cases per 100,000 people in the population. And you can see, based on this graph, the Black and African American race has over 2,000 cases per 100,000 people, as well as the Hispanic and Latino population, over 2,300 cases per 100,000. And that's a great disparity from the white race or population, which is at 512 per 100,000. So like you said, even in New Hampshire, we are seeing this health disparity amongst this population.
Right, so we are working quite hard at public health to correct some of this, hiring some new community health workers in different languages that are heard around the Nashua area, and hoping to really work with some of these populations so that they're getting in and getting tested if they need to, and staying healthy, and immunizations, and not just COVID testing. So give us some advice. How do we slow the spread of COVID-19?
So the major thing would be to stay home if you are sick. We are coming up on cold and flu season, so it's always, as New Englanders, we are used to being sick. We're used to fighting through being sick and going to work, take your Dayquil and go to work. But with COVID-19, that is not recommended anymore. Any sort of symptoms that are cold and flu related, you should seek a test to see if you are positive for COVID-19.
And that's an important point, because any little symptom now, whereas you just write it off, oh, it's allergies, or I just had a headache, or even these small subtle symptoms can be a sign of COVID-19. So we really want people to take that to heart. That's the only way we're going to know, is if we do a rule out test. So go on. What else?
Continuing to wear a mask when in stores, when you are unable to maintain social distancing, other public places such as restaurants. We're going to see a lot more restaurants starting to open up, which is good for the economy and good for people to get out. But as long as we are keeping safe and wearing our masks, avoiding large indoor gatherings and small indoor gatherings, and always keeping a 6 feet distance away from people not in your family or household, and as well keep washing your hands like we have always mentioned, and make sure we're washing for 20 seconds every time.
Right, and that warm water, get it going, get some friction going. So these things are really important. The CDC just came out with something saying time is cumulative. So if I'm around you at close contact for 2 minutes and then another 4 minutes, and it's varied, or throughout the day, that is an accumulation of time that puts us all at risk of greater exposure. So really have to be wearing our masks and keeping that 6 feet apart. So if you'll bear with me a little bit, we do have Halloween coming up. So we do need to go through some Halloween guidelines. We've just come out with some guidance. Halloween is on in the city of Nashua, and so we want to talk about avoiding sick or treat. This is a borrowed something from someone. But if you plan on trick-or-treating this year, please follow these tips, okay? We want people to wear face masks, not costume masks. So I know it's a great time for kids to dress up, but really those masks that you pull over your head and cover you up are not protective. And even wearing a face mask and that mask over, that's going to cause difficulty breathing. So we just say decorate your mask, not your costume mask, decorate your regular mask, and just make some adjustments for this year. So we do ask that people still wear your face masks. We ask that people get rid of grab bowls if possible. We don't want a lot of hands in the pot grabbing candy and whatnot. It's usually candy. There's really no whatnot on Halloween. But if you can put them out at a table and let the kids come by and pick them up, or think of something clever. Somebody said they were using a long wrapping paper tube and they were going to send it down the chute to the kids. There's some fun ways you can do and maintain social distance. The other thing we want to say is stick with your family and stay in your neighborhood. No more driving to another neighborhood and making their neighborhood very crowded and unsafe. Even if you're outside, those big crowds at close proximity can cause spread. So stay with your family, keep 6 feet away. And then if you're staying home this year, there's lots of great ideas out there. Just a few: have a scavenger hunt, have a family game or movie night, bake some fun goodies, some crazy Halloween stew. And if you don't want trick-or-treaters at your door, just turn off your lights. I mean, it's really that simple this year. So if you're not comfortable going out, please just turn off those lights and cozy up to a nice Halloween movie, and be safe out there. We're in this together. The other thing is, we would really discourage those raucous Halloween parties that often are held not so much by children but by adults. This is not the year for those parties, so please bear this in mind, and let's keep COVID-19 out of our community. So Evan, thank you so much for being here. I really appreciate your time. I wish you all the luck in the world as you travel on to your next rotation, which is?
Family medicine.
Oh, family medicine, excellent. So best of luck to you, and to everyone else. We'll be right back. In these challenging and changing times, the Nashua Division of Public Health and Community Services would like to share a public health moment with you. Chief Public Health Nurse Kim Bernard is here to answer a common COVID-19 question for you. Here's a question from our COVID hotline. We had someone who had close contact with someone with a confirmed case of COVID-19. They tested negative while they were in their quarantine. Can they stop their quarantine, or do they need to complete it?
That's a great question, Jane. So yes, in New Hampshire, you do need to continue your quarantine for the 14 days. The virus can take up to 14 days for it to become positive in someone's body. So say you got tested on day 3 or 4 and it was negative, you could still become positive even up to day 10, day 14. And that just has to do with the way that the virus works. As far as what quarantine means that you would need to stay away from other people. So it doesn't necessarily mean you're sick, it just means that you've possibly been in contact with someone that does have the virus, and you need to stay away from other folks so that they don't get the virus. Isolation, on the other hand, is for people that are either have tested positive and they may or may not be symptomatic or have symptoms. So those folks need to stay isolated, and that just means that they need to stay in an area in their home away from other household members whenever possible. That means a separate bathroom, if able, a separate bedroom where they would spend most of their time, and just trying to isolate themselves so that other folks in the home or outside of the home don't get sick.
For more information on COVID-19 or to schedule a COVID-19 test, call 603-589-3456 or visit our website at nashuanh.gov/COVID-19. Welcome back to Public Health Matters, where we talk about matters in public health. I'm now joined by Lisa Vasquez. And Lisa is our Substance Misuse Prevention Coordinator. And how long have you been at the division, Lisa?
Almost 7 years.
Almost 7 years. So tell us what you do as a Substance Misuse Prevention Coordinator, and what your responsibilities are.
So as a Substance Misuse Prevention Coordinator, we work with the schools, police departments, fire departments, pretty much any community agency that wants to enhance prevention throughout the community. So with schools, we try to have messaging out for the schools so that they can in turn give that to the children and the families to enhance just the messages that kids receive. We also support youth risk behavior survey, which happens in the schools every 2 years. And there we can hear, are the kids hearing these messages? So one of the questions is, have you heard any prevention messaging during the past 12 months? So I can gauge, am I doing a good job at making sure kids are getting prevention messaging or not? And then we work with the police departments and making sure that they have resources available. So if they have any opioid or substance misuse related arrests or calls, they can give resources to those family members or that person so they know where to go to get help. We also work with them on the DEA Take Back Day, which is actually going to be this weekend, and we'll talk more about that later. And then we work with just all the agencies and programs that provide services. So places like treatment centers, recovery housing, things like that, to make sure that they have all the information they need. They know what other community partners are doing, where they can refer people, to make sure not only do they know, but that the community knows where to go when they're seeking treatment. And we also work on making sure people know behavioral health services in general are available, so mental health awareness and making sure people know what resources are available for their mental health and wellness, as well as suicide prevention resources and awareness in the community. So those are the three major things I work on.
Those are three very big things, Lisa.
Yes.
It sounds like it would keep you very busy. Have you been able to maintain your work through the pandemic? I mean, of course, we've all stayed working in public health, but what has changed? You're obviously not meeting in person. Just give me a sense of how it's changed for you and how you've been able to kind of pivot and be creative.
I haven't been able to do any face-to-face anything, so yes, a lot of Zoom meetings, and being able to work with community partners has been pretty similar to what it's been like before, making sure I call, email, am aware of services that are available in the community. That has stayed the same, but being able to work with schools in the same capacity I've worked in the past, going into the schools, making sure they have speakers for like Red Ribbon Week, which is kickoff today.
We'll get to that too.
Yeah, we'll get to that later. Those things haven't been able to happen because most schools are not in person right now,
especially
or
in
in session.
Nashua.
Yeah. So those things have taken a back seat, not just for myself, but for the schools. Because even schools that are open are not going to have big assemblies right now, because that's not recommended.
So you're the person that comes in with a lot of that information for the students, or arranges for somebody to come in.
Yeah, I usually think kids don't want to listen to me, so I bring someone more exciting.
I don't believe that. So there's a lot going on, even though school isn't in session, and we're trying to carry on because dealing with substance misuse is a critical issue in the community, and always has been. It's been, you've said 7 years at the department, at the division. So even prior to the 7 years, you've been doing this for 7 years. In the last several years, we've been hearing a lot about the opioid epidemic. And so you've always been working on probably alcohol abuse and other different kind of drug misuse. And then we got to the opioid kind of forefront. And I know you're involved with something called the Opioid Task Force. And I did want to talk a little bit today about what's going on, because you are reading that some, overdoses may be down, and things have changed a little bit with the COVID-19 pandemic. So can you address that a little bit?
Definitely. So across the nation and even in some parts of the state, we have seen an increase in opioid use or general substance misuse. But in Nashua, we haven't really seen an increase in opioid overdoses or opioid fatalities. They've been pretty much the same as they've been in the past few years. It's still a large number because we wish that number were zero, but it hasn't really spiked like we've seen in other places. What we have seen an increase in is mental health crisis and people visiting the emergency departments for mental health crisis. So what we know of from years and years and years of research is that the underlying causes of most substance misuses, of mental health crisis, and of suicidal ideation is that they have very similar root causes. And most of those are feeling unseen, feeling unheard, not being valued, feeling isolated, loneliness, depression, financial instability, all that kind of bubbles up into what sometimes leads people into self-medicating to help alleviate those feelings and then end up with a substance use disorder. And what we're seeing now with COVID-19 is that many people are having to isolate due to stay-at-home orders or just minimizing risk to getting infected with COVID-19. So as we see the mental health crisis escalate, we don't want to see the opioid crisis escalate or the meth or stimulant crisis escalate. Because one thing we have been seeing across the nation as well is that for many people who sell drugs, it's become cheaper for them to make things like fentanyl, which is synthetic, and meth, which is synthetic, so that they might sell other things, say heroin, and it's laced or is actually fentanyl or meth, and people think they're taking like heroin, or they may think they're using marijuana, but it's laced with meth or fentanyl.
And that becomes very dangerous.
And that becomes very dangerous. And one thing we've seen with meth is that people may not overdose per se, but they end up with cardiovascular issues and may have heart attacks. And also their mental health gets compromised a lot more, and people go into mental health crisis when they're using meth.
Wow, it's interesting. I didn't know that.
Yeah. So it's a very moving target all the time. It sometimes feels like whack-a-mole when you're working in substance misuse prevention. Because things change rapidly. So we saw the opioid crisis started with heroin, actually started with prescription drugs, then moved to heroin when we started talking more about the dangers of prescription use, over-prescribing, people using medications more than they were supposed to, and things like that. When doctors stopped prescribing as much, saw that this was a real issue, then people moved to heroin because they were already had a substance use disorder. And then heroin became too expensive for some people, or for people who sold it. They started making fentanyl, which is cheaper to make, but also more potent. So people started overdosing at larger numbers because of that. And now we're seeing a transition into meth. So it's again, a moving target, but the underlying causes is the same. People feeling lonely, isolated, or trying to fill something internally, or to numb some pain that they're feeling. So really, when we are treating substance use disorder, we are really treating an underlying mental health condition most of the time, or feelings of isolation, or other trauma in either childhood or early adult life.
So have we seen overdoses go down during COVID, or have we seen them go up? I mean, what is the general sense of what's going on?
Like I said, it's hard to pinpoint because nationwide there's been a lot of people are talking about a spike in overdoses. There, if we look at like Coos County here in New Hampshire and Stratford County, there's been a slight increase in overdoses. But when we look at Hillsborough County and Nashua specifically, there hasn't really been an increase, more of a slight decrease in the last 365 days.
So that's sort of good news.
Sort of good news, yes.
But we worry about the isolation.
Yes, and we are worried about the isolation. And also, like if we look at emergency department visits for opioids, we see that there was a really large decrease in April because of the stay-at-home order,
Right.
and we have seen an increase incrementally during the past few months, but that's to be expected because so little people,
Right.
much less people went in April, so it's going back to normal numbers, I would say.
Wow, so there's a lot going on.
Yes.
It's hard to keep track of all of this.
Yes.
So tell me, you mentioned prescription drugs. So there's an event this tomorrow. Tomorrow, so hopefully people are watching this tonight, Friday, and there's a, just tell me about it. It's a prescription drug take-back day.
Yes, so the DEA, the Drug Administration Agency, does this event every 6 months. It's called the DEA Take Back Day. Most of the police departments in our region participate. Nashua's participating again this year. They're doing, just as they did the previous years at Celos Drive, at
It's
Stellos.
Stadium Drive.
Stadium Drive.
Yes.
Yes, 9 Stadium Drive.
That's correct.
Okay.
And we'll put that information up behind
Yes,
us.
9 Stadium Drive. But instead of it being in the garage, you're going to drive around the garage so that you are not going to be indoors. So we're still going to social distance. People are still going to be wearing masks. If any resources are going to be given out, they're going to be given out with grippers so people can stay still 6 feet apart.
The claw.
Yes. But it's really important for people to make sure that if they have any unwanted, unused medication at home, that they dispose of it. So this is an event where they can safely dispose of that medication. And if people wonder what happens to that after they drop it off, it gets incinerated. So no one's going to get to use that medication. It's important that people clean out their medicine cabinets because people that go inside your home, whether they're family, friends, neighbors, we don't know who has a substance use disorder or who has a propensity to get a substance use disorder. It's really important to remember that medications are only for the person it is prescribed for. So if people are using a medication that's not for them, it can be potentially dangerous. Especially if you have kids in the home, small kids, sometimes they take things because it looks like candy. So it's really important that you keep them away from small children. They could end up in the hospital because of any medication. It doesn't even have to be a pain medication.
Right.
It could be your high blood pressure medication, your thyroid medication, doesn't matter.
Right, especially if it's prescribed for a big
Yes,
person and then a little
exactly.
person takes it. because-
Exactly. So it's really important to make sure you're secure your medications. If you're using them, they're up to date, you need them, make sure they're secure and that only the person who it is prescribed for has access to them. If it's prescribed, for example, for a teenager, it's really important for parents to hold on to it and give that medication to that teenager when it's time for that medication. Because again, children, teenagers, their frontal lobe is not fully developed. They're not
Right.
sometimes able to make the best decisions.
Yes, I have a few of those in my house right now.
So it's really important to help them out during that time and make sure that they're taking their medication as they should. It's also important if they have things like stimulants, so Adderall, Ritalin, things like that, that parents keep a hold of it if they can and give it to them when it's required, as opposed to having the child hold that medication, because many children share medication and that can be very dangerous for other children.
So just let's take one step back, because you did mention prescription drugs before and your whack-a-mole kind of example, but one of the big discoveries several years ago was that this kind of misuse of prescription drugs, taking, and it did really start around the pain meds and that kind of thing, and people getting too many pills for maybe a dental surgery or an orthopedic procedure or something, and those pills just kind of still being around after you needed them. Maybe you use 7 pills and there's 10 left. So that's when it was really this discovery about prescribing too many and then having that left around. So if you could just tell us a little bit more about how that movement has worked. And I think people are getting the message. I'm not sure what you think, if the data has changed at all, if people are becoming addicted to the prescription drugs still first, or have we curbed that, or what do you see in our area?
It's possible that people are still getting, started in a substance use disorder via the pain medication, but it's less likely. We do have a drug monitoring program here in New Hampshire. So every time a prescription is filled, that information is sent to the state, and they can see how many doctors are prescribing, how much each doctor is prescribing, how much each person is prescribed. And if they go to various pharmacies and various doctors, that can be now tracked. So it's really hard to get a large quantity of prescription drugs in New Hampshire. They're also working with the states that border New Hampshire to be able to share information as well, so that people can't get medications here, then go across the border to a doctor and get medications across the border as well. So that's been very limited, and I think it's really great that that is being limited.
Yeah.
It has caused some issues for people who genuinely need that medication. So it creates hurdles for people who genuinely need the medication sometimes, because they can no longer get like 6 months of medication, for example. They get a shorter, like 1 month supply, and then they have to go back. Some people need to be on contracts for their medication to make sure they're not going over. If people do lose their medication or something like that, it can be harder for them to get a new prescription. So there's always pros and cons.
Right.
But overall, I think we have more options for people who have pain. More alternatives than there were before. I think we came from a generation where everything had a pill for an answer, and that's not necessarily the case for every single symptom that people have. So it's also important. I think we also came from a time when, I just remember my mom long ago. Someone would come over and they would have a pain or something. She's like, "Oh, doctor prescribed me this." I'm like, "No,"
Right.
But obviously,
You were
it
born
was
to
a
do
long
this.
time ago.
Yeah.
But still, you have to remind people that that's not something you do. And even movies you watch and things like that, you see ladies hanging out, drinking wine, and one of them says, "Oh, I need this," and the other one takes it out of her purse and shares it.
Right.
Those are not acceptable
Right.
things.
That's
because
just like Motrin and Tylenol.
Yeah.
Those are the limits of the sharing that should be done.
So I think that was pretty normalized in movies and shows, so much that people started doing that in everyday life, and those are things that are just not, you shouldn't do those things, because you don't know how someone else will react to the medication that was prescribed to you.
Right. So really, on the positive note that we have, worked on that problem, the messaging has gotten out that, that is just so critical, to, again, bring your drugs, unused prescriptions, this Saturday, tomorrow at Stadium Drive.
And it's from 10 to 2 p.m.
Okay.
You're not allowed to bring sharps. So if you have any sharps that you need to dispose of, please take them to the hospital. Both of the local hospitals have sharp disposal containers in their lobbies. So if you go to Southern New Hampshire, their sharps disposal is by the emergency department entrance. But if you go to St. Joe's, it's right in their main lobby. No questions asked. You just go up and you dispose of it, and then you can leave. We want to make sure people are able to dispose of their sharps in an effective and fast, easy way.
Great. So if somebody misses this DEA drug prescription take-back day, it has a new title every time I bring it up, but this prescription take-back day, where else can they leave their things? I know the hospitals have some drop boxes also with some bags. You put it in, it goes in the box, and
Yes, so both of the hospitals, again, have drug disposal boxes. Southern has it at their main entrance, so not at the ED entrance. You go on the other side on Prospect Street, and on that main entrance, they have their prescription disposal box. St. Joe's has it in their main lobby, just like the Sharps container. And also, you can go to CVS on Main Street or Walgreens on Main Street, and they have drug disposal boxes as well. The the police department has a drug disposal box. If you go to Hudson, Amherst, Merrimack, Litchfield, Pelham, in Wilton, they also have drug disposal boxes in their lobbies. The police departments do.
So this is not a one-time event. We do this to bring awareness to it, but if you miss it, by all means, please, get rid of your old things. You're making me think I'm going to go home and clean out my medicine cabinet. and I don't have any painkillers, but I do have some old medications, and really there's just no reason to keep them laying around because
So I want to remind everyone that if you have medications at home that you are no longer using, they're expired, please get rid of them. There's no need to have them in your home. Some people are like, oh, I broke my foot 2 years ago, I still have this medication in case I get pain. No, if you get hurt again, you're going to go to the doctor and you're going to get new medication. You don't need that old medication. So please get rid of it so that no one else is tempted to take it. And again, it could be dangerous to kids. So we want to make sure it is taken out of your home. If for any reason you have any mobility issues, transportation issues, and cannot get to the event tomorrow, cannot get to any of the locations that I said, you can give us a call at the health department at 603-589 4538, and you would get my direct line. But I have the Terra bags, which are drug deactivation bags. So if you can't leave your home or you're just unable to get to those locations, I can mail you out a drug disposal kit that you can do it at home, and it deactivates the medication, and then you can throw it in the trash.
Great, that's great to know. I didn't know that until now, that you had those. So we also have something else kicking off. I believe it's tomorrow, Red Ribbon Week.
It starts today.
Oh, it starts today.
Yes,
Well, we timed this really well, Lisa.
Yes. So Red Ribbon Week starts today. If you have any children in the Nashua School District, you probably received a letter from their guidance counselor saying it's Red Ribbon Week. This are the activities that we're going to do this week to celebrate. So today, kids were supposed to wear red for Red Ribbon Week to start the celebration and kick it off. The National Prevention Coalition is really leading the charge in celebrating Red Ribbon Week here in Nashua. And then we have Community Action for Safe Teens, which is CAS in Milford, and they are working in that area to really, expand on the message of Red Ribbon Week. I have to say it slow.
I know, you can't say that 3 times fast. So how did Red Ribbon Week start? There's a little story behind it.
Yes. So in the 80s, there was a DEA agent who was working to stop some drug trafficking over the border in Mexico, and he was murdered, which is very sad. But out of that, this celebration began so that we can remember how important drug prevention is. It's important to stop before we start the use of substances so that we don't end up with a substance use disorder or all the other negative effects of substance use. So since then, every year across the nation, schools, high schools, communities celebrate Red Ribbon Week. So if you drive down Main Street right now, you'll see a big sign that says Red Ribbon Week, because we all want to make sure that it's really a time to have a conversation with your kids. So talk to them about making good decisions. And one good decision that they can make is not using substances. But if they're young kids, you're not gonna really talk about drugs really in depth with them, but we're still gonna talk to them about making good decisions in general, making sure that they don't follow what everyone else does. They can, run to the beat of their own drum.
Yeah. Yes.
Making sure that they feel confident in their decision-making process and they feel good about the decisions that they make and proud of the decisions that they make. That's what it's about.
Wow. So we have a lot going on, starting with the prescription drug take back and Red Ribbon Week. And this is continuous. We're not just doing this for days, for a couple days. This is a year-round project for you to really spread awareness. So we thank you for what you're doing in the Nashua community. And if we could beat COVID out of our community, we will hopefully get back to face-to-face. But in the meantime, Again, thank you. And I want to remind our viewers that we do have a COVID-19 testing clinic every Tuesday from 3 to 5 in the Elm Street parking garage. And you can go to the Division of Public Health and Community Services to our website, and under the testing link, you can sign up online, or you can call the COVID hotline at 589-3456. So until next week, please stay safe, wear your mask, wash your hands, stay home if you're sick, and see you next week.